preventive work
Yeah, yeah.
in younger kids. That was one thing I really, really respected Dr. Andrews about was he wasn't somebody who was just immediately going to slap somebody on the operating room
Right.
table, and particularly kids. It would, he would have tough conversations with parents who, thought their kids were going to be the next MLB players or whatever, and say, no, at 10 years old, this is all the pitches they can throw without doing harm to their elbow for later, or he would shut them down. Now, most of the time people listened, but sometimes they didn't. And he would laugh and say, then I'll see you back for surgery in about 2 years.
I really like this point because I want to take this little brief aside here and talk about, modern day travel baseball, which is really popular around here.
Yeah.
I'm sure you might have a few thoughts about this, but effectively these kiddos, and they're pretty young, are playing baseball maybe 11 months out of the year straight. And that's not something that used to be done in the 80s and maybe even 90s. There was a little bit of separation. You were doing different athletic ventures along the way. You were playing basketball and soccer and football and then baseball. And so, and there's also kind of a more competitive push, it seems like. Kids are doing baseball camps at younger ages, and we're probably also seeing some more sports-related injuries now that has increased in frequency. Do you have any thoughts about any of those things?
I think sports are great for kids to participate in because they teach them so much more than playing a sport.
Absolutely.
Teamwork, mental agility, the whole 9 yards. So we were always 100% behind kids participating in sports, but doing it smartly.
Right.
And you can't have a kid whose growth plates are still open throwing 200 pitches 3 times a week and not expect to have some consequences of that. So, that's where we came from is, yes, participate, but do it in moderation.
Yes.
So that you don't hurt yourself.